Good evening, everybody. I am Dr. Sarah Patel, and I, on behalf of Dr. Dhanipkars Homeopathic Child Care, welcome you all today to the occasion on this occasion of Children's Day. So, what is the main aim? Why all of us have gathered today on this platform? This is because of our children and for our children to provide them a better and disease-free future. मैं थोड़ा सा आपको अभी पीछे ले जाती हूँ हमारे बचपन में. So how many of us remember how our childhood was? We as children used to have so much time outdoors playing. हम गार्डन जाते थे, हम घूमने जाते थे. We used to visit our relatives so frequently. After coming back from school, we used to just throw our bags, have our lunch, and just go out to play. Can you all relate to this? You can all comment in the comment box if you all can relate to this. And I don't remember if I used to have ice cream almost every day or frequently have outside food or going on dinners and lunches and having a movie time was a celebration. Can we all relate to this? Yes? Yeah. But our children, they have a very, very different childhood. So I begin with wishing all of our lovely children a very happy Children's Day. So आज हम रिलेट कर सकते हैं कि हमारे बच्चे आजकल बहुत फ्रीक्वेंटली बीमार पड़ते हैं. They miss their school regularly, डल रहते हैं. After coming back from school, most of our children say कि मम्मी मुझे आज खाना खाने का भी मन नहीं कर रहा है. I'm feeling very dull. And they don't even have the proper meals what we have prepared for them. Do we all relate to this? ऐसा क्यों होता है? हमारे बच्चे आजकल इतने डल और बिल्कुल खाना नहीं खाना है ऐसे क्यों बोलते हैं? Can we do something about it? So today's entire session is getting educated for this. The main reason why our children frequently fall ill nowadays is because of the lowered immunity. So what is immunity? How do we understand immunity as? So immunity is our body's resistance power. Our body resists the infections and the bacteria that come to us. So the immunity helps us to fight the bacteria and fight the infections. और जब ये इम्यूनिटी कम हो जाती है, जब हमारी बॉडी का रेजिस्टेंस कम हो जाता है, तब हमारे बच्चे फ्रीक्वेंटली और बहुत जल्दी बीमार पड़ते हैं. So let's understand that what are the very common and general factors that affect our children's immunity. हमारे बच्चों की इम्यूनिटी बहुत जल्दी स्टार्ट होती है. When a mother gets pregnant, that is the time when the children's nutrition starts from the mother's womb. Mother's history during pregnancy, mummy ka mental state, her physical state, everything is expressed on to the baby even before the child's birth. And very essential factor is mother's breast milk. Whatever the mother eats during the entire course of pregnancy and during breastfeeding, everything is transferred to the baby. And mother's milk helps the child in fighting infections. वो बच्चे का resistance power infection के against बढ़ाता है. So our child does not faces early childhood illnesses. The same thing goes if the child is having लो vitamins, उनका न्यूट्रिशन लेवल्स कम होता है, तब भी वो जल्दी बीमार पड़ते हैं. और छोटी छोटी बातों पे, जैसे कि थोड़ा सा कोल्ड हो गया, सर्दी हो गई, बच्चा छींकने लगा, खांसी हो गई, तो हम पैनिक होके उन मेडिसिन पिला देते हैं. So repeated medications also lowers the immunity of our children. Do we do this? Right? Nowadays, थोड़ी सी सर्दी हो गई, then we give them medicines. खांसी हो गई, we give them medicines. So repeated medications also reduces their immunity. And especially the immunosuppressant medicines like steroids, inhalers, that also adds up in reducing the resistance power of the body. Few other factors are improper eating habits, what our children are doing nowadays, less of physical activity. Nowadays, our children rarely go out to play. We have to literally push them to go out and play, yet they don't want to. Physical activity increases the cardiorespiratory health of our child. It helps in improving the bones and joint health. And it also increases the muscle capacity. Another major important point is lack of sleep. जब हम सोते हैं, during that time, our body grows. Our body releases hormones that helps our body to grow. And also, it helps us to repair the damage that has caused throughout the day. So in short, sleep helps in growth. So जितना अच्छा नींद बच्चे का होगा, the more the child will grow. Also, कुछ cases में देखा गया है, the children that come to our clinic, the diseases also go back to genetics. So genetics and family history also play a very important role in deciding the child's immunity. So how to understand? हमें कैसे पता चलेगा कि हमारे बच्चे की इम्यूनिटी कम है या उसकी रेजिस्टेंस पावर कम है, उसकी लड़ने की क्षमता कम है? Let's ponder over a few of the commonest ailments by which we will understand this. So nowadays, frequently falling sick is the major indication that your child is having a lower immunity. थोड़ा सा ठंडा पानी पी लिया, गला खराब हो गया. थोड़ा सा बाहर एसी में बैठ गए, ठंडी हवा में बैठ गए या एसी में बैठ गए, छींकें आने लगी. सोर थ्रोट हो गया, टॉन्सिलाइटिस हो गया. बहुत जल्दी जल्दी बच्चे बीमार पड़ते हैं. Yes? Can we all relate to this? Type a yes if people, you all can relate to this, what I'm telling. Yes. So all these factors point that our children are having a reduced immunity, frequent allergies, asthma, chest condition. So few other factors that we can relate to nowadays is your child is not eating well. बहुत से पेरेंट्स क्लिनिक में आते हैं और बोलते हैं कि हमारा बच्चा खाना नहीं खाता है. Do your child also say the same? कि मम्मी भूख नहीं लगी है, बस हो गया, अब मुझे और मत दो. Yes?
Yes.
Yes. So these factors also relate us that our child is having a lower immunity. They refuse to eat. They have abdominal pains, discomfort in their stomach, frequent diarrhea, nausea, vomiting, recurrent skin infections, recurrent allergies, hives हो गया, कुछ colored food खा लिया या कुछ preservatives वाला खा लिया, then the kid have hives or they develop an urticarial rash. And nowadays we have seen so many cases of hand, foot and mouth diseases, which were not there earlier. But these kind of infections are increasing with the time due to the lowered immunity of our children right now. So ये तो हो गई immunity की बात. But there are other common conditions also that we are seeing frequently in our practice today. Our child is being underweight or obese. Child obesity is one of the major concerns nowadays. क्योंकि बच्चे घर पे बैठे रहते हैं, they eat all the unhealthy stuff that they can, बाहर खेलने कम जाते हैं, so they keep on gaining weight and they are not having a proper physical activity, or they are underweight or losing weight. Many parents come and say हमारे बच्चे का वेट नहीं बढ़ रहा है, they are not being healthy, या वेट कम हो रहा है. Do you also feel the same for your child? Yes. And many other factors that we see regularly in our practice is anemia, that is lowered platelet counts or lowered red blood cells. One of the very important factors that I would like to enlighten you all is nowadays with the psychological issues that our children facing. And this has increased since our children are sitting at home due to COVID. So many parents don't realize that their child is having a hyperactivity disorder. They are suffering with ADHD or learning disabilities. This is a topic in itself. If all of you are really interested in this topic, then they can comment and we can have an entire session for this learning disabilities and psychological disorders in children. But for now, I just wanted to enlighten these points to you. So now we have understood that our child frequently falls ill. तो हम क्या कर सकते हैं? What we can do for our children to have a better immunity? बहुत इम्पोर्टेंट है और बहुत ज़रूरी है ये समझना कि कॉज क्या है, रीज़न क्या है रिपीटेड इलनेसेस का, हमारा बच्चा क्यों बार बार बीमार पड़ रहा है. ठीक है, और वो कॉज को हाउ कैन वी करेक्ट इट यूजिंग द करेक्ट मेडिसिन्स, यूजिंग प्रॉपर न्यूट्रिशन. हमें एज पेरेंट्स क्या करना चाहिए अपने बच्चों के लिए कि उनकी बार बार बीमार पड़ने की जो रिड्यूस्ड इम्यूनिटी है वो कम हो. The major factor is we have to reduce the screen time so that our children are going out frequently and having physical activity more than a sedentary life. Outdoor activities, as I mentioned earlier, increases a child's ability to grow. It helps in proper development and strengthening of bones and joints and muscles. And then proper sleep is very essential for their growth. So now we as parents, I know every one of us are very concerned when it comes to our children. थोड़ा भी बच्चा बीमार पड़ गया, रो रहा है, थोड़ा सा warm feel हो रहा है, we are feeling them warm to touch, then we don't know what to do. We don't understand कि हमारे बच्चे को क्या हो रहा है. Have we faced all such situations? Yes? Our baby is crying suddenly. They got up in the middle of night at 2 o'clock and the baby suddenly crying and we don't know what to do. हमने just उसके forehead पे हाथ रखा, we feel that there is temperature और हमने क्रोसिन पिला दिया. Right? Have we all done this? Yes? I'm sure many of us have done this. So let's now understand that when are we supposed to not panic as a parent. So most parents panic when our child gets a fever और हम जल्दी से एकदम उनको क्रोसिन, ibuprofen पिला देते हैं to bring down their fever because we want to comfort our child. But what is fever? हमें फीवर को कैसे देखना चाहिए? How do we understand what is fever? So fever is not a disease. Fever is our friend. Fever हमारा friend है. So why does fever happen to us? So fever is because of certain chemical reactions that happen in our body to raise the temperature so that it creates unfavorable circumstances for the bacteria and viruses and the body itself fights the infection. So actually, fever is helping your body to fight any infection that it is attained from outside. So in case of fever, we should not get panic. Rather, हमें cautious रहना चाहिए. First thing we need to do is take a thermometer and see how much is the fever. Many a times there is a low grade fever, and body by producing a low grade fever, the body takes care of itself. The body takes care of the bacterial or viral infection that is there inside the body. And we as parents need to note what all is happening. What are the symptoms that our child is producing in fever? Is there a nausea in fever? Is there vomiting? Is there body aches? Is your child having a cough during fever? So there are various reasons why the body produces fever. So we have to understand that those causes, rather than just treating the fever, we need to understand why the fever has come. And by treating the cause, the fever will automatically be taken care of. It is very important for you as a parent to note the symptoms and say it to us so that we can understand what the fever is like, and we understand and treat the cause better so that the fever is automatically taken care of. Also, fever comes in different stages, and during each stages, we as parents need to note down the symptoms that your child is having. That will help us to treat the fever better. Few things that you can do at home for your child in fever. So can you relate to this कि जब भी हमारे बच्चों को fever आ गया, we put 2 to 3 blankets on them, we cover them in socks, we put a cap, हम उनको पूरा कवर कर देते हैं, and we feel कि कवर करने से बच्चों का fever चला जाएगा. Yes, we do all this. We have done all this, right? But it's not that way. When your child is in fever, you actually need to keep your child cool. आपके बच्चे को आपको लूज कपड़े पहनाना है, कॉटन के लाइट क्लोथ्स पहनाना है, so the heat is transferred out rather than being stuck inside. Avoid too many extra blankets, socks or caps when your child is having a fever. And when your child is having chills, जब आपके बच्चे को ठंडी लग रही है, वो टाइम पे you can cover them. But when your child is in heat stage, when he's getting hot, when the child is getting hot, that time you can give a sponge bath with lukewarm water. Or you can make your child sit in lukewarm bath for few minutes to let the fever come down. And if your child is breastfeeding, you have to give him your breast milk repeatedly and frequently to get the fever down and keep your child hydrated. And also keep the room well ventilated so that air can freely circulate. So how high is too high? When do we actually need to give fever medicines to our children? So any fever that is above 101 needs to be addressed. And when to see your doctor immediately for your child in fever. When your child gets a sudden fever, a sudden high fever is a concern. And when your child is having headache in fever, बहुत headache हो रहा है, severe headache हो रहा है. Many children will complain of neck stiffness, which is again an emergency situation, because many times when a child have a very high fever, there is inflammation in the brain which expresses in the form of neck stiffness. So if your child complains of having a stiff neck, difficulty in movements of the neck, or is having pain in the neck, you should immediately visit a doctor. If your child is complaining of a severe abdominal pain or breathing difficulty in fever, you should immediately take your child to the doctor. If there is a history of convulsion in your child, then also it needs to be addressed immediately. Breathing difficulty. So how do we understand breathing difficulty? For this, we need to understand respiratory rate. What is respiratory rate and how to understand it? So, respiratory rate is how much time your child breathes, like taking a breath in and out is one respiratory rate. So you have to put your hand on your child's chest and feel how many times it moves up and down is one respiratory rate. So any respiratory rate above 30 is of concern and you need to speak to your doctor. बहुत सारे बच्चे फीवर में मोन करते हैं. They don't answer to you properly. They talk irrelevant. Even in that case, you need to address the fever immediately. Many of us feel that a rash coming on our child is an allergic rash, but all rashes may not be allergic. It may indicate to few serious erectile fevers that needs to be bring to the doctor's concern. Also, fever in babies under 3 months of age, you have to immediately address to a doctor. So I already spoke about breathlessness. How do you understand breathlessness or your child is having an attack of asthma? You need to check for the respiratory rate. And if your child looks pale, he have blue nails or the toes are going blue and having slightly bluish discolored skin around the mouth, that time also you need to understand that your child is struggling to breathe. When your child is having a severe cough and your child is having sweat, cold and clammy skin while coughing also needs to be addressed immediately. Any wheezing or chest pain along with cough is also an emergency condition. Few other factors when we don't understand what to do are ear pains. So how do we understand ear pains as? So there are few of the common causes through which we understand ear pains. Is one of them is sinusitis. When our sinuses are blocked, हमारी नाक बंद हो जाती है, we have cold that is stuck in our sinuses, it leads to ear pains. From pressure changes, when your child has frequently had a trip in an airplane, that time also your child can complain of a severe ear pain. Foreign object, कुछ कान में चला गया, then you need to take your child immediately to a doctor. और ये समझना बहुत ज़रूरी है कि ear pain is with or without fever. If it is with fever, then there is some infection and it needs to be addressed. So what can we do when our child is having a ear pain? सबसे पहले आप अपने बच्चे को comfortable position में बिठाएं. Let your child be in an elevated position, okay, to give him some comfort. Another thing that can help your child in ear pain is giving a warm compress that can relieve the ear discomfort to an extent. And the things that we are absolutely not allowed to do during an ear pain is inserting cotton buds or anything inside the ear or cleaning the wax. That is going to further increase the pain and discomfort of your child. Always show your child's ear to a specialist if you want to clean your child's ear. Now next we come to diarrheas. Many parents, they come with their children having loose motions. So when do we decide that loose motions is really a concern for our children? Many children eat outside food and they suffer with a little bit of a stomach upset. 2 to 3 loose motions in a day is okay. It is still manageable. But when it is more than 5 to 6 times, it is of concern. You have to consult your doctor immediately for the following conditions. If the diarrhea is lasting for more than 2 days, if the child is passing loose motions multiple times for more than 2 days, you have to immediately show your child to a doctor. Diarrhea, along with vomiting, can dehydrate a child, so it needs to be treated accordingly. So, when do you immediately go to a doctor? If your child is having a diarrhea and having lightheadedness, dizziness, weakness, kamzor ho gaya hai, they don't have energy to walk after having an episode of diarrhea, then it is understood that your child is dehydrated. What are the other signs of dehydration? When your child passes less urine, or your child is passing dark urine, or your child is feeling thirsty more frequently, dryness of mouth, sunken eyes, all these are signs of diarrhea. So we need to look, all these are signs of dehydration. So we need to observe our children. If they are dehydrated, that is of concern. So at home, what do we do in cases of diarrhea? When your child is having a diarrhea, how can you comfort and make your child feel little better in diarrhea? It is very important to keep your child hydrated. Give them oral rehydration supplements, oral fluids. If your child is vomiting along with diarrhea, then you can simply tell them to eat the ORS and not give any liquid to avoid further vomiting. Give light food, avoid any heavy food, avoid any solid food, give semi solid food, give food like toast, dry food to avoid further vomiting. And it is very important to avoid diarrhea medicines. The over the counter medicines that we get for diarrhea, we should avoid them. We should not give our child frequently. Another important condition is abdominal pains. We also get panic when our child is having an abdominal colic. So what is a colic? How do we understand a colic? Colic is a pain that comes in waves, and it comes and it goes. And the major causes of colic is indigestion. Our child have eaten something from outside and they get a colic, gases, bloating, constipation. But it is very important to also understand that at times a child even pretend to have a abdominal colic just to seek attention of parents. So what can be done to ease the abdominal pains? At home, give gentle massage of warm oil in an upward motion. Also, at times, few children find it comfortable to lie on their abdomen and they feel better for the abdominal pain. And you have to avoid all sorts of solid food during that time. In case of abdominal pain that is localized, you have to immediately see a doctor. And if there is continuous pain or persistent pain, in that case, you need to immediately see a doctor. So each child is different, and each child will come with a different expression of disease, and we have to understand differently. I hope this session was helpful for you all. Okay. Now I pass on to Dr. Kavita, our doctor and nutritionist, who will highlight some nutritional fact regarding our children.
So, hello everybody. Good to see you all here in such a large number. So, as Dr. Sara said, there are a lot of factors which are concerned for our child to fall sick frequently. So, our body is made up of millions and trillions of cells, and they all to work together. We have to provide our kids with very good nutrition, which overall helps the child to be physically and emotionally fit. Once we give them a child correct meals on correct times, it will help us to boost their not only physically but develop their brains too. And then we give them a very safe tomorrow with a disease-free and happy life. In early childhood, it's very important as a part of us that we give children a good nutrition and tell them what is good for them. So we, rather than telling them what to eat and what not to eat, we tell them how to make choices. We give them options for the choices, and then they choose accordingly and go ahead. Poor diet right from the childhood will always lead to essential vitamin and nutrients that the child lack in them. Okay. Nowadays, it's very common that children come into our clinics with vitamin D deficiencies, vitamin B12 deficiencies. These all are nutritional deficiencies which lead to so many other complaints. Hmm? Commonest complaints that we see nowadays in our clinics, children come down because of nutrition deficiency or because of not having correct food, is their weak immunity. Another thing that we see is anemia, where the blood formation doesn't happen frequent. Because of low vitamin C intake or low protein intakes, we see that the children get cold and cough very frequently. किसी और ने छींक दिया, फैन के नीचे बैठ गए या एसी से कुछ रिलीव हो गया तो इमीडिएटली बच्चे बीमार पड़ जाते हैं. Little higher side food, little heavier food, children can't tolerate. They end up having diarrhea or constipation. So the major role here for diarrhea and constipation in children nowadays is lack of physical activity or lack of proper balanced nutrition that we give to the children. A lot of children come down with a lot of irritability, with a lot of anxiety. एक जब बैठेंगे नहीं क्लिनिक में आके, you'll see keep on moving them here and there, restless होते हैं, irritable होते हैं. So a lot of times we try to figure out what it is, and it generally we find that there are some part in the meals that are missing in kids. There are some part of the meals that we need to change. There are some part of in the preparations that we need to change. Again, the common other factors that we see, children are underweight or children are overweight. These are topic by itself to be discussed, but we will discuss this in the later sessions again. So can we do something to correct these things? Of course, yes. We have to think about it, and there are few points that I would like to discuss how to correct the child's nutrition. Okay. Now, when parents come to us in our clinics to tell us about child's health, कि मैम हम लोग इसको सब देते खाने के लिए लेकिन ये नहीं खाते, हम लोग तो रेडी रहते कि हर फ्रूट इसको दे, महंगी सी महंगी चीज इसको लाके दे, ड्राई फ्रूट्स का डिब्बा भरा पड़ा है घर पे लेकिन नहीं खाते. But tell me one thing, amongst all these parents, how many parents really have good nutrition in their routine lives? How many of them seriously eat fruits, vegetables, or for that matter, dry fruits in their regular meals? Correct? So you should always remember that children do not listen. They see what their parents do. So parents are the biggest role models for their kids. They will always follow their parents' footsteps. जिन घरों में पेरेंट्स लोग ईट गुड फूड, जिन घरों में पेरेंट्स हैव रेगुलर मील्स which are balanced, children will also follow their rules. There are kids, it's not like that our children don't have. There are kids who have proper meals, who have dry fruits, who have nuts, but their parents have taken a lot of efforts to be with them. Okay, so the main thing is first we have to follow certain rules so that our kids follow them. Okay, we have to start eating healthy food, explain each and every food that we have to the kids. They generally really pick it up very fast. Okay, make them involved with you in food making activities. Okay, it can be anything. You can just tell them to pluck to kari patta from your plants or tulsi todne ke liye bolna, या you just tell them to clean vegetables or wash them. Yeah, simple cutting, yeah, stirring. So very simple activities. Children find a lot of comfort in that, like, mummy ko help kiya hai, so I will eat food which I have made. These are the things which really help children to go fall on the track. Okay, variety of foods is nowadays which children need to have on their plates, है ना. तो हम लोग अगर एक रोटी सब्जी भी दे तो you make them in a frankie, you make it a vegetable roll, name it differently and give them. Children very happily will eat up and finish up their plates. So there are different patterns, different things that you have to explain them. Different colors have different nutrients. So whenever you serve your children, try to make them a little more interesting, try to make them a little more attractive, and children generally end up eating that. Okay? Make meal times a priority. Always see to it that one part of the meal every day is with the full family. So it can be your breakfast, it can be your lunch, it can be your dinner, anytime. It should be uninterrupted with any other thing. So see to it that you do not have any phone calls, you do not end up on a gadget, but let that dinner table be a priority wherein you discuss the whole day routines, wherein you discuss what you have done. Do not scold children on the meal tables. If they're not eating fussy about the food, just avoid it. Be slow and steady. Things generally take a time to change. Okay? Mealtime should be pleasant. Please do not argue or do not give rules for children to eating. Just tell them to concentrate and then they will start eating food again. Now, small children, there are a lot of mothers whom I have seen कि आके मुझे बोलते कि मैम मैंने एक रोटी के ऊपर खाते ही नहीं है, मैम इनको एक कटोरी सब्जी देती हूँ तो उसमें से आधी ही खत्म करता है, टिफिन में मैं इसको एक सैंडविच देती हूँ उसमें से आधा ही खा के आता है. Remember, children will have a very small quantity of meal every time. We as parents have to understand that it is covered with all nutrients. It need not be the quantity that they eat, but the quality that we give them and the quality that they consume is very, very important for them to eat. So choose a diet which is very dense in nutrients and then they can eat a small quantity, that's fair enough. Do not ever force feed your children. They will end up not eating the food or they will end up having over meals. Okay, children will never feel hungry, children will never stay hungry, they know how much to eat, they understand how much is required, or children ज़्यादा भूखे नहीं रह सकते. So don't worry, your children will not sleep empty stomach. Okay. Again, second commonest thing that बच्चे आके बोलते हैं उसके साथ का जो फ्रेंड है ना वो तो इससे भी दुबला है मैम, लेकिन वो कितना खा के खाता है. तो इसके साथ का जो दोस्त है वो इतना मोटू हो गया है, इससे बहुत कम खाता है, मेरा बेटा वेट ही नहीं पुट ऑन करता है. Don't compare. Okay, children's diet, two children, though the age is same, they are in the same class, will always have different nutrients, will always need different nutrition depending on the physical stature, depending on their activity levels, depending on their mental makeup, and depending on the genetics. So never compare two children, two kids in eating patterns. Okay. कॉमनेस्ट थिंग दैट वी डू जनरली इसके घर पे हम लोग बिस्किट्स ला के रख देते हैं या वेफर्स पैक करके रखेंगे, यू नो. सो वी आरसेल्व्स आर एंड देन वी कंप्लेन कि बच्चे तो वही खाते हैं. हम लोग फ्रिज में रहते हैं, घर पे आके देखो तो बच्चे ने मैगी बना के खा ली होती है. सो समवेयर वी आर आल्सो कल्प्रिट फॉर इट, राइट? Yeah. So you change the things that we store at our home, keep something healthy and handy, wherein children can have no other option but to eat it, right? So do all these things. These are very simple things which you can start following. The last thing which I would like to act upon is never ever give food as a reward or punishment to your kids. दिस इज द कॉमनेस्ट मिस्टेक दैट वी एज पेरेंट्स मेक. आप अच्छे मार्क्स लाओ, आज हम लोग आइसक्रीम पार्टी करेंगे. आप आज अच्छा मुझे आज आप ये कमा के दिखाओ, यू गेट सम प्राइज, देन आई विल टेक यू टू अ पिज्जा पार्टी. Never ever keep food as a priority or a reward or punishment for them. You give them different rewards. You can replace it with so many other activities wherein you yourself involve with the kids and see to it that they fall and they do follow that. Okay. टेक स्मॉल स्टेप्स एट अ टाइम. आज मैंने बोला इसलिए कल से इमीडिएटली सब चीजें चेंज नहीं होगी. टेक स्मॉल स्मॉल स्टेप्स, एक एक चीजें आगे आगे जाके सारी सारी थिंग्स विल बी फॉलो. सो स्लोली इज द स्टेप फॉर फास्टर चेंजेस इन लाइफ. ओके. So every child is unique and special. Okay, keep your childhood, keep their childhood memories by ensuring a better life. Okay, so I think with this I end my session here. I would wish everyone a very happy Children's Day. And if there are any queries or anything, you can ask us, or you can be in connection with us on our WhatsApp group. If you want any other sessions or if you want any interactive sessions, any queries, you can ask us, or we can be in touch on WhatsApp group. Yeah, Kayur, you can take over if there are any questions. Okay. Exactly. Yeah.
Hello.
Hello.
Yeah, Kavita ma'am, good evening.
Good evening.
I'm Dr. Urmi here.
Yeah, Dr. Urmi. Can you on your video, please, Dr. Urmi?
Yeah, sure.
Yeah, go on. Yeah, tell me.
One thing, nowadays we do get children with very premature graying of hair and falling of hair. So, the special advice we can give for nutrition base.
So again, the causes of hair fall and causes of premature graying of hairs are very, very different depending on the cause. we have to treat them accordingly. If it's a
But
nutritional cause, yeah. So if it's a nutritional cause, we have to consider the whole nutrition, the daily nutrition of the child. And then accordingly, if proteins are less, we have to add on proteins. If vitamins are less, we have to add on vitamins. So according to their daily recall, we have to add in few dietary tips for them.
but even
It is not
premature,
one.
maybe nutrition does help.
Yes, in some parts, if it is because of nutritional deficiencies, then it is, because nowadays it's not only genetic reason. Earlier it used to be कि parents को है तो बच्चों को भी आता है. तो आजकल तो 7-8 years child also comes
Yes.
with lot of premature growing. Yes, और उनके मम्मी पापा के बाल are good till 30, 35, 40. So it's now not only genetic, but yes, genetic plays a major role in these cases. But again, it's a personal diet chart that we have to check in with them.
But does homeopathy help in this way, these things?
Of
How
course.
long we?
Yes, we have been treating patients with premature graying of hair since I think almost 20-25 years. So we have a
Okay.
different plan of treatment for them, wherein
Okay.
we take in consideration everything, right from the genetic cause to the nutritional cause to the products that they use to their lifestyles, everything. And once we
Okay.
do that in totality, we then treat the patients accordingly.
Okay.
Yeah.
Thank you.
Yeah. So ideally, if the patients are having fever above 100, we generally tell them to keep a observation on them. Neha, are you listening? If the fever is rising slow and steadily, if it is managed at 100 till you see the doctor, ideally we do not give any medicines. But if the patient is restless, if they have a history of convulsions, or if they have any other restlessness along with it, then ideally after 100 we tell them to give medicines, whatever their pediatricians or whatever we have given medicines to them. But till 101, ideally, if there is no past history or no other complaints along with it, you should keep it, you should see whether the fever is maintained. Many a times the body temperature comes down by itself. So do sponging, give them good water, and other things that Dr. Sara has told us during the lecture. Just do that basic cheese, and I think they should be okay. Hmm. So Shivani, if the kid is autistic, there are n number of tests we need to do and confirm that the child is autistic. In homeopathy, in initial stages, again, as I said, the reason and the whole case taking process helps in autistic children, but it's a long process. It is not only a part of homeopathy. Homeopathy plays a major role, but along with it, you'll have counseling sessions. There are for certain things that the parents have to follow. There are certain things that as a family you have to change. So autistic child, to be labeled them as autistic, there are a number of tests that we need to do from a psychologist and a psychiatrist. Yeah. Hmm. Nothing to do. So that's what I told you. Generally, children in school, ऐसे होता है कि children eat one other's tiffins and do. Okay. When you give them meals at home, children generally tell you कि घर पे कुछ टिफिन में किसी का कुछ खाया है, कुछ शेयर किया कि नहीं. As I told you earlier, Pahi, do not force feed your kids. Okay. Children cannot stay hungry for more than 1 or 2 days. So do not panic. अगर चिल्ड्रन भूखे हैं और नहीं खा रहे बट दे आर स्टिल एक्टिव प्लेइंग अराउंड वेल, उनका खेलना कूदना एक्टिविटीज में कोई फर्क नहीं देख रहे हो आप, then please do not force feed your kids. Give them small nutritions and then finish that off. In case if your child is not eating after school, we do have to work it out, but only if the symptoms persist. The way I told you, उनका activities कम हुआ है, they are not socially interactive, बहुत चिड़चिड़ हो रही है, then we have to interfere with it. और उनका वेट लॉस हो रहा है, दुबले दिख रहे हैं, then we interfere with it. Yeah. So a lot of small kids nowadays have milk intolerance, milder symptoms of milk intolerance. One of them is constipation. in all these years, we have also observed that stopping milk have solved a lot of the problems. So it is not only milk, Amandeep. There are a lot of replacements for each and everything in nutrition. May it be milk, may it be wheat, may it be rice. Everything has a replacement. Okay. So according to the symptoms and according to his daily diet routine, this constipation can be treated. Milk is a part of it. So that this is a totally different topic by itself. There are a lot of substitutes. Milk is not only rich in calcium, but it is rich in proteins and other vitamins also. And milk consumption, according to age, according to the person's physical activity, will differ from person to person. Okay, so we will have a proper total separate lecture for this, for milk and what to give at what age for kids. And it's perfectly fine if your children don't have milk. It's perfectly fine. We can replace with a number of things depending on their daily and routine activities. So don't worry, as parents के दूध नहीं देते तो बच्चे weak हो जाते हैं. It is just a marketing gimmick. So don't fall prey to it. Okay. So if there is anything, we will be connected with each other on our WhatsApp group. Let us know if you need any more interacting sessions or any topics that you need to be covered from our side. Okay, from my side, we wish you all a very happy Children's Day, and I hope this session finds in a good health for everyone. Thank you.